Question 11. An elderly resident has an advanced health directive that includes a DNR, do not resuscitate, order. You enter the room and find them not breathing. What do you do? A. Call for help and begin CPR. B. Call the family to see if they agree with the DNR. C. Close the door and notify the nurse. D. Start the resident on oxygen at 2 liters per minute. Answer C. Explanation. An advance directive states that what a person wishes at the end of life. It is a legal and binding document that avoids any confusion for medical professionals and the person's family. If a person does not want to be resuscitated, the CNA should honor the resident's wish. Quietly notify the nurse when the resident passes away. Question 12. You arrive at the client's home for care. She shows you a burn on her arm. It is blistered and client is complaining of severe pain. You should A. Call the home health case manager. B. Drain the blisters and cover with gauze. C. Call the client's doctor. D. Call the client's daughter. Answer A. Explanation. A burn that develops blisters can be serious and should be evaluated if it covers a large area of more than 3 inches, 7.6 centimeters. The client's skin may appear red, white, or splotchy with swelling. The client will also complain of severe pain. Do not break blisters. Call a supervisor for assistance. Question 13. A patient asks for an extra pat of butter from an aide who is unfamiliar with her. The aide should A. Offer margarine instead because it is a healthier option. B. Check the patient's diet and give the butter if allowed. C. Get her the butter to demonstrate excellent patient care. D. Refuse and tell her that butter is not good for anyone. Answer B. Explanation. Every patient has a diet plan that is specific for their medical condition. When working with a new or unfamiliar patient, always check the care plan or orders for the prescribed diet. If an item is not allowed, help the patient understand that there is a reason for the restriction. Ask the nurse to request that the dietitian visit the patient to explain the diet. Question 14. A resident with an obstructed airway, A. Cannot speak, B. Can speak, C. Is always unconscious, D. Can breathe. Answer A. Explanation. Choking occurs when food or an object is stuck in the trachea, white pie or airway. A person who is choking cannot breathe or speak. They will automatically grasp their throat. Quick action is required. The Heimlich maneuver, abdominal thrust, is used to dislodge the object. Do not perform the maneuver if the person is coughing forcefully and able to speak. Question 15. You walk into the dining room. The conscious resident has his hand to his throat and is making no sounds. The first thing you will do is A. Offer a drink of water. B. Ask, are you choking? C. Start chest compressions. D. Call the nurse. Answer B. Explanation. A person who is choking will automatically grab their throat. This is a signal for help. Abdominal thrust, the Heimlich maneuver, is the best response to choking. Calling for assistance as you prepare to do abdominal thrust will alert others of the emergency. A quick back slap can be tried, but if the food does not immediately dislodge, the nurse aide must quickly move to start abdominal thrust. Performing abdominal thrust involves standing behind the client and using hands to exert upward pressure on the bottom of the diagram. Question 16. What should you do for a person who has stopped breathing and has no heartbeat? A. Perform abdominal thrust. B. Call the ambulance. C. Start chest compressions. D. Do mouth-to-mouth resuscitation. Answer C. Explanation. In 2010, emergency assistance for a person who is unresponsive without breathing changed to CAB. After placing the person on the back, begin with C. Chest compressions to keep the blood circulating. A. As a certified professional, stop after 30 compressions to clear the airway. B. Two rescue breaths are given between compressions. If possible, call for help before and during the process. Question 17. The first aid treatment for hemorrhage is to A. Run and get the nurse. B. Put on a tourniquet. C. Lower the arm below heart level. D. Apply direct pressure. Answer D. Explanation. Hemorrhaging, heavy bleeding, should be stopped as soon as possible. Use direct pressure on the wound with a sterile bandage or a clean cloth. Use your palm to press firmly. Maintain pressure by adding more layers of bandages and binding the wound with tape or cloth. Do not remove the bandages if bleeding continues. Continue to add layers and keep pressing. Always call for help as we begin first aid. Question 18. When caring for a resident who is hemorrhaging, you should A. Apply direct pressure to the area. B. Stay with the resident and call for help. C. Use the principal standard precautions. D. All of the above. Answer D. Explanation. When providing emergency care for a hemorrhage, immediately call for help. If gloves are available, put them on before applying pressure to the area that is bleeding. Proceed to maintain direct and firm pressure on the wound with your palm pressing on the bandage, gauze, and clean cloth. Continue the pressure, adding layers of bandages as needed until help arrives. Question 19. A nurse aide walks into a room and sees that the patient is unconscious. The first thing the aide does is to A. Hit the patient's chest. B. Press the alarm to call the court team. C. Shake the patient's shoulder while shouting his name. D. Tilt the patient's head back and give 2 quick breaths. Answer C. Explanation. If you find a patient who is unconscious or unresponsive, do not immediately begin CPR. First, shake and shout by calling their name and asking if they can hear you or to open their eyes. If they do not respond, call the code team, lower the head of the patient's bed, and begin compressions. Even if they do respond, notify the nurse immediately. Question 20. Your home health client is diabetic. When you go to his home, you find him weak and lethargic, but able to follow commands. He is unable to tell you when he last ate or took his insulin. You should do what first? A. Do nothing. He's just tired. B. Check his blood sugar level. C. Call the ambulance. D. Notify the case manager. Answer B. Explanation. When a client with diabetes is sleepy and difficult to arouse, immediately check their blood sugar level with a glucometer. A result of lower than 70 mg per deciliter or higher than 2200 medical emergencies and requires prompt treatment. Every home health client has a plan and supplies for very low or very high blood glucose levels. If in doubt, contact emergency medical services. Thank you for watching.